Okay, hold on. This is not clickbait, and I do know what I'm talking about. I promise. I'm an optometrist that specializes in interventional dry eye, and in today's video, I'll go over why dry eye is not an eye disease. Rather, it's often a manifestation of systemic disease. It's a skin disease, but an eye disease? No, that doesn't quite cover it. This is Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty. I'm an eye doctor that treats patients with dry eye, and I pay special attention to makeup and skincare. I even have an esthetician that I work closely with in my practice. I'm obsessed with helping you achieve beautiful, comfortable, and healthy eyes. Make sure to hit the subscribe button if you enjoy my videos, as I'm publishing them weekly. So dry eye is defined as a multifactorial disease of the ocular surface characterized by a loss of homeostasis of the tear film and accompanied by ocular symptoms in which tear film instability and hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities play a role. Holy cow. What that's saying is that inflammation happens on the ocular surface, it alters the tear film, and your eyelids and everything that contributes to your tears plays a role. We also know that 5 to 15% of people have dry eye, so it's an incredibly common disease. Women are affected disproportionately as compared to men, and it's more common with lots of screen time and comorbidities like diabetes, hypertension, etc. It increases with age and can be caused by systemic medications. Autoimmune disease increases the risk, and allergies exacerbate the symptoms. All right, so all of those things I just listed, isn't it interesting that almost all of them have to do with systemic issues? Think about it. Menopause, it affects our entire body when our hormones change. Diabetes, that's a systemic disease, as is hypertension. Autoimmune diseases are systemic diseases as well that cause low-grade inflammation throughout your body. Dry eye happens as a result of all of these systemic diseases, as well as skin diseases like rosacea or blepharitis. And so therefore, it's become my position that dry eye isn't really a primary eye disease at all. It's not like macular degeneration that starts and ends in the eye. This is more accurately described as a secondary effect of what's happening in your entire body and with your skin disease as well. All right, so hopefully I've got your attention because that's not the normal way to talk about dry eye. So let's talk about some of the common systemic diseases that cause a secondary dry eye. First, we've got diabetes. Most eye care professionals speak extensively on the connection between diabetes and the development of retinopathy or macular edema. However, one of the most common and honestly often overlooked ocular manifestations of diabetes is dry eye disease. So the Beaver Dam Eye Study, which is very famous for diabetic complications, showed that nearly 20% of participants between age 43 and 86 with type 2 diabetes had dry eye as well. And another study done by Milton Hom, an optometrist, indicated that 53% of patients with either diabetes or borderline diabetes had reported clinically significant dry eye. That's a lot of people with dry eye and diabetes. Another study showed that 55% of patients with diabetes had at least mild dry eye signs and symptoms throughout the day. So we are seeing patients with dry eye disease potentially as a secondary cause from diabetes. Next, we've got Sjogren syndrome. Now, Sjogren syndrome is an easy one because this is an autoimmune disease that causes dry eyes and dry mouth. It affects us systemically and results in, usually more severe dry eye symptoms. This disease can be tested for with the use of a show test, which is what I use in my clinic. Next, we've got another autoimmune disease. This is rheumatoid arthritis. And patients with rheumatoid arthritis often suffer from the signs and symptoms of dry eye disease. There's been research done on RA patients in the UK revealing that more than 70% of folks in that study tested positive for dry eye disease. And similar to diabetes, it appears that the more severe the patient's RA, the more significant their dry eye symptoms. Likewise, in SLE, or systemic lupus erythematosus, or lupus, many people call it, many lupus patients have also been diagnosed with dry eye. In a smaller study of just 36 patients with lupus, 57% had pathological dry eye. We also know that thyroid eye disease contributes to dry eye. So because of hormonal changes and then exophthalmos, which just means that the eyes kind of bulge out a little bit more, that results in corneal exposure. Thyroid eye disease is a common systemic disease that's associated with dryness. And then several inflammatory conditions like irritable bowel syndrome and Crohn's disease have a high incidence of dry eye. One study on patients with IBS, or inflammatory bowel syndrome, showed a 22% prevalence of dry eye disease compared to 11% incidence in age and gender matched controls. And then secondly, let's talk about some skin diseases or dermatological diseases that cause dry eye. Several conditions that affect the skin, such as rosacea, have a high incidence of ocular surface disease or dry eye as well. Additionally, patients with psoriasis have an increased likelihood to develop dry eye. In one study in psoriasis patients, 50% showed significant conjunctival impression cytology differentiation that was indicative of dry eye. So we are seeing dry eye signs, symptoms, but also within the research, the signs that you'll develop dry eye in psoriasis patients as well. Furthermore, we don't completely understand what causes seborrheic blepharitis, a common condition that exacerbates dry eye syndrome. Could it be that blepharitis is a skin disease that causes dry eye as well? So tell me, did your dry eye disease occur as a result of a systemic or skin disease? What do you think about my pronouncement that dry eye disease is really a secondary side effect of systemic or skin disease? Make sure to let me know in the comments below. That's going to be it for today's lesson. Class is dismissed. I'll see you next time.